Okay, good evening, everyone. Dr. Alan Christensen here with you. And I am live, and we are doing our webinar about metabolism. So really happy to be here with you guys. I'm with a group on Zoom. I'm on Instagram. I'm on Facebook. All these platforms are great, and I'm happy to connect with you. Those on Zoom, one perk is you guys can raise your hands, and we can do some live Q&A at the end. And these are always so much fun. They're great because I can pull you in. I can see you. I can hear you. We can speak in real time. If you're not on Zoom, you're welcome to go to drchristensen.com. You can find the link and you can register for the event and come on and hang out there as well. But you're fine everywhere. I will do my best to keep my eyes open for some things that come in on other platforms, best I can. Now, as I mentioned, you can raise your hand on Zoom. If you're on Zoom and didn't know that, you could raise your hand on Zoom. It's pretty cool. So under the participants section, you can raise your hand. And if you've got a question about metabolism, weight, thyroid disease, how that pertains, go ahead and do that. Last couple times, I couldn't get to every single one, but I did go through those in order. So if you do have a good question, get it up earlier. And I struggle with covering all the questions and being detailed about a few questions. And I tend to err on the detailed side. And my belief is that a lot of questions are similar. And if I go into good depth, I'll hopefully answer some of the ones that I may not be able to get to. So yeah, I'm seeing some comments coming in. Just got my vitamins first order. I'm waiting for mine. I think they're coming pretty quick too. Someone got them before me. So yeah, I'll talk about the new vitamins, but also about weight and metabolism. Talk about some 3 big steps to boost that. So here we go. And really happy. This is a super important topic, as you'll learn and hear about. I'm going to share my screen and get some slides going up here. And when we're done, I will take that away and go back to just me. But for right now, let's see. I got a lot of stuff going on in front of me. Okay, portion of the screen, and there it is. All righty. So now those are up. So I want to tell you what I'm going to tell you about, then I'll tell you about it, and I'll tell you what I told you about. This is good teaching. I'll give a quick synopsis at the beginning. We'll go through this in real good detail and wrap it up at the end and grab some questions. I'm thinking, 30, 40 minutes for my talk, and then whatever we can do for questions afterward, and we'll take it from there. So the 3 big steps, I'll talk about the relevance of action steps. That's what these are: the metabolism reset diet, thyroid health as it pertains, and then also metabolism boost. And before then, I'll also talk about why this happens, the large number of symptoms this can cause, some of the things that could be giving rise to it, and some of the big barriers it might get in the way. I'm also going to talk through some of the popular ideas, some of the big myths and misconceptions about weight, and some big truths, some things that we do know. So yeah, let's dive on in. And I'm seeing more and more come on. So welcome. I'm with you guys on Facebook Live, on Zoom, on Instagram, and more coming on. This is our metabolism boost discussion. We'll talk all about metabolism. If weight has been a struggle, that can be an issue of, the pounds come on too fast. It can be the pounds don't go off easily enough. The inches are very relevant to health. And it can also be just someone that they can maintain, but they got to work really hard to do so. And that's a valid concern about it as well. So those are all the facets of that we'll talk about. A couple of real quick announcements. Well, I guess one real quick announcement. So we had been in the pre-order stage, but like several of you that are already commenting that you're getting your stuff, when pre-order stage is over, we are up and operational. And we did do a sweepstakes. We've got some winners for those sweepstakes. So Pam S., Cindy L., Diane E., and you've all already been contacted, so it won't be a surprise for you, but we've got our 3 winners. So the 3 of them and myself will coordinate our schedules, and I'll look forward to meeting with them and talking to them in the coming little bit. So yeah, thank you all for supporting our pre-order campaign, and we got our winners, just as promised. So what gives rise to poor metabolism? What causes this? Well, some of the big things we think about are things that people are talking about and worrying about. Of course, thyroid disease. And a little more depth in this one. So we know that too little thyroid hormone can slow basal metabolic rate. And by how much? Well, by a lot, sometimes even like 60%, so 60%. So if someone had a resting metabolic rate of around 2,000 calories a day, that might be a little high, but it's easy math for me, so forgive me on that. They could be as low as somewhere around 6 times 2, so 1,200. So they could be as low as 800 calories per day, meaning that if they consumed much more than that, they could gain weight, and they could not lose weight unless they had a big deficit below that. Now, the other thought is that there's also a certain range to metabolism. So even if someone doesn't see that just they have to consume a small amount, it may be the case to where they've got a really exact threshold. And once they get slightly above that, they gain, and they only lose if they go way below that. So thyroid disease plays out in that way too. We also think about fatty liver being a big contributor. And what happens there is your liver stores excess fuel, because that's the thing, is that there are certainly pitfalls about the calorie model. One of them is that we never get the precise amount we need on a given day. We're always going to get more or less. And if we've got a good, healthy metabolism, it doesn't matter. Our body stores the extra and has the means to deal with that without it turning into stubborn weight gain. And we can also get by when there's a little bit too little. But when the liver is off, we cannot do that. So the adrenals are relevant toward this. In thyroid disease, it can be too little hormone, like I said, but too much does that too. And that's often really surprising for people, but we'll talk about that. So when there's an excess of thyroid hormone, if there's a catastrophic excess, if one is at some of the later stages of hyperthyroidism, there's almost always going to be some loss in scale weight. So the scale number will get smaller. But there's, at that point, pretty much always a worsening of body composition, meaning that there's less lean tissue. So the scale numbers might look better, but the mirror would not. But the more common thing is that the milder versions of hyperthyroidism, they often cause weight gain. And what happens there is when there's a bit too much thyroid hormone, the body starts to fight against the effects of thyroid hormone. Fat cells will not break down. The body will not easily tap into fat for energy, and the liver is going to build up even more than it would otherwise. So yeah, a little too much can make things worse. And this is important because there was a popular idea that extra thyroid hormone was an easy ticket to weight loss. And when I started practicing in the mid-90s, there were doctors that I knew that they would say that openly, that they would take patients that struggled with their weight, and regardless of their thyroid function, they would just put them on a lot of thyroid hormone, thinking that it was like a weight loss pill. Not only that it didn't work, it was not safe. There was a lot of deaths from that mistake. And to this date, thyroid hormones all carry a black box warning saying, not for weight loss. It just doesn't work and it's not safe along the way. So too much or too little. Also, we know that the autoimmunity of thyroid disease may be an issue. So thyroid antibodies can be a factor, even if thyroid function is otherwise stable, as can sleep issues. Now, the antibodies, the adrenal health, the sleep issues, these are all topics that are ones that we have covered and will cover, and they're all important on their own right. They all contribute to this. So I think about, I think about like learning something almost like a painting project. So what's the first thing you got to do when you want to paint your wall, or you want to paint something out in the garage? Well, you got to tape stuff, right? There's that. But before then, you got to clear off the old paint. You got to get rid of the misconceptions. And that's the thing. I think it takes more time to unlearn than it does to learn. There's so many ideas that float around, and, I catch as many as anyone. And it's so easy to take things that seem to be true, things that make intuitive sense, things that you hear repeated a lot, and they just burrow their way into your mind, and they're there. And once they're there, it's hard to really have other data come in, because what we learn in comparison to what we already know. So if we already know things that aren't serving us, it's hard to learn the things that can. So I always like to really clear out myths along the way. So top metabolic myths. Well, a big one involves the macronutrients. So carbs, fats, proteins, these are the macronutrients. Macro, they're big. That's stuff you can actually see on your plate. Micronutrients would be the vitamins, minerals, the phytonutrients, but the macro ones are the big stuff. And these are the things that carry fuel. And these are the things that actually give our body mass. And it's been really tempting to think that one of them is to blame, that, it's because of carbs, it's because of fat, it's because of protein. And you can find some really well-written, well-intentioned arguments how any one of these three is a demon. And there's really only three places we can get sustenance, and those are the three. So if you cut any one of them out, you cut your food intake down by a lot. And for a while, you're eating less food. And a lot of folks will have weight loss from that. That's temporary. But what happens over time is that either we don't cut them down as thoroughly, or we find a way to compensate with the other two. If you go low fat extremely enough, then next thing you know, you're living off of jelly beans and pretzels in addition to food. Or if you go low carb extremely enough, then the other version is the lots of extra butter, lots of extra nuts and seeds, or paleo Atkins snacks. It's not one versus the other. These things have been studied ad nauseum. And when people are put on a low version of either of these, they lose some weight, they gain it back. And it doesn't matter which or how it is. None of these are bad. Another big misconception wraps around ketones. So a lot of folks that don't really understand the biochemistry of ketosis, they'll tell you that you go into ketosis when you're burning fat. It's the exact opposite, you guys. It's the exact opposite of that. When your body is unable to burn fat, you convert that fat that you can't burn into ketone bodies. So it's just like you're changing dollars for pesos. You're not getting rid of money, you're just converting it. And ketones are actually less useful than fat is because your liver can't burn them and other tissues can't use them as well. Now, they certainly do some good things in the body, but we make them even when we're not in ketosis. We can make them just from exercising. We make ketones. So ketones are not bad things, but it's not the body burning fat. It's when fat burning stops. So when we burn fat, we run a chemical process called beta oxidation. And beta oxidation is basically oxygen plus carbs plus fat equals a whole lot of energy. But when there's no more fat to run beta oxidation, we stop it. And when we can't burn fat, we convert fat into ketones. And from that point, if we're running at a deficit, we'll burn ketones. But if we're not running at a deficit, we won't burn ketones. There was a really big study done by Kevin Hall and associates, and it was done in a metabolic ward. And two groups of people were put on the same amount of food, identical caloric load. One group was on a ketogenic diet. One group was on a highly processed diet, mostly carbohydrates, a lot of sugars, a lot of processed carbs, but the same amount of food. Now, the study wasn't to see if they would lose weight, but they ended up losing a bit of weight. Those on the processed carbs lost more fat. We can't burn fat without carbs. We only convert fat without carbs. So yeah, there's not really a free lunch from ketogenics. But here's the weird thing. Our metabolism uses a shortcut to tell us if we're starving or not. And if our carbohydrate intake is way too low, our body thinks we're starving. We inhibit our activation of thyroid hormones and AMP phosphase, our body's enzymes that regulate energy balance, think that we're in an energy deficit. So yeah, if we're too low carb, our body thinks we're starving. And that doesn't mean that we lose weight per se, but it means we slow down our metabolisms. So our sleep gets impaired, we shut down our thyroid hormones, and a lot of things change. That's why the rebound rates of weight gain are so high with these diets. Fasting, time restricted feeding, food frequency. And I want to say too, nothing here is like inherently bad. If anything worked for you, I'm supportive of that. Any way that causes someone to lose fat and keep it off is probably going to do them a favor. But what I really want, the question I want to answer is, what's most likely to work when nothing else worked? What do we know from good controlled studies? Sometimes someone can get lucky. It's a fluke. It was a one-off. It worked for that person, but it might not work for everyone. I want to know what's most likely to work for the largest number of people. And food, timing, and fasting are not effective strategies for lasting fat loss for most people. If one fasts, they can also lose scale weight, but they'll tend not to improve body composition because a lot of what they lose ends up being muscle tissue. Now, meal timing, trying to eat more frequent meals or skipping meals, it's been studied in such detail. And how much food you eat is, what happens. If you eat a lot of food in a small number of meals, you'll gain weight. And if you eat little food over a lot of meals, you can lose. But the question is, how do you keep fat off and how do you keep it away? That's what we'll talk more about. Ice baths, going outside in the cold, not a big difference. We're talking about a couple of calories, so nothing too significant there. Those are some top myths that are out there. And I want to mention a few top truths, some of the things that have been perennial recurrent truths that have stood up from large numbers of separate lines of inquiry. And of those, well, satiety matters. So how much a food fills us up will affect how much we eat. And that's almost like a tautology. It's by definition. Some foods are more filling than others. And that can be a function of how much water it has, how much fiber, how much starch it has. Protein, there's some overlap because that also can impact satiety. So the more we eat filling foods, the less we'll end up eating afterward. Probably one of the worst negative examples of that would be sodas or liquid calories. Those are things that have the least impact on satiety per their relative food contribution. I've talked about some studies on satiety before. There was one in which they gave people controlled amounts of, I think it was 40 or 50, probably like 40 different foods, and they monitored them afterward to see how soon they got hungry, how much they ate, how they rated their hunger. And it was the same amount of hunger they had going into it at each different time. By far, the most filling single food was boiled potatoes. And not a coincidence that I've talked about those as being a good source of resistant starch. Next up is protein. So dietary protein has a large impact upon body composition, on appetite, and on basal metabolic rate. And it doesn't mean that you'll get your best results by living off of protein, but it means there's an optimal amount. And this is an amount that you often don't fall into by accident. It's something that often does take some thought and some planning. And that's probably somewhere around a quarter or a third of one's total caloric intake. Another way to look at that is somewhere around a gram of protein per pound of lean body weight. So whatever one's fat mass is, we take that out. If really easy math, let's say that a person is 200 pounds and that they're 30% body fat, making up easy numbers. So 30% of 200 is going to be what? 60 pounds. So we take that out. So they've got about 140 pounds of lean body mass. So they should think about roughly 140 grams of protein on a typical day. And the thing is, even when you are lowering your food intake, that protein number doesn't change. So when you're lowering food for intentional weight loss, because there's less total food, the protein takes even more thought and more planning. And I'll talk more about that as to why it's central for the metabolism reset. Protein, fats, and carbs. It seems that our satiety, our metabolism, they do the best when we get a certain amount of all of these. And the protein probably has the least amount of personal leeway for effectiveness. That's probably in those ranges that I mentioned. The fat and the carbs, we don't want only one and we don't want none of either. Apart from that, you've got a lot of options. So you can do a little more of one and a little less of other, or vice versa, but you don't want none of either. You don't want to be on the extremes for those. Exercise for weight maintenance. This is a real big truth. Exercise for weight loss is a bit of a myth. So exercise, not an effective strategy for weight loss, but a very important part of weight maintenance. So in the metabolism reset, I encourage activity, but rather limited. And that's something that took a lot of thought, and it really goes against a lot of conventional wisdom. But when you train hard and you eat less, your body goes into a storage mode, and it greatly heightens your stress hormones. Diet quality, this does matter. And not a surprise here, but the more unprocessed our diet is, the better we'll do. And big studies have shown that as well. If you do nothing but vary the quality of food available, people gravitate towards a lower total amount of caloric intake. Food enjoyment. You've got to eat the things you like. There are healthy ways to make the things you like, but you can't totally deprive preferences and tastes. And then meal planning. We've got good data on this one as well. Basically, the more we think through what we will be eating and the more we plan and have in place, the better we're going to do. I'm wrapping up a manuscript right now. This will be a cookbook. And I've really gotten in the rhythm of Sunday being like the day in the kitchen. So I usually shop on Saturday or Sunday, but Sunday I'm prepping all the veggies. I think through all the meals for the week, and I do as much as I can ahead of time. And it's really not hard. It's like a couple hours tops. And most of the work for the whole week is when you're already in there doing something, it's so efficient to just do all of it. It's so much time in the kitchen is spent starting and stopping and cleaning and taking stuff out, putting stuff away. If you've already got it out and you're going to make a big mess and clean it up all at once, it's so much easier. So I'm having a blast with that. But meal planning is a hugely beneficial habit. Okay, so let me get a little emotional on you guys. This is why I'm excited to talk about this topic and why it's important to me. So I had cerebral palsy as a child. It was a milder form of that. And it was mild enough to where I was allowed to do things like gym class. I think I would have been separated these days. But back in the 70s, they didn't pay much attention to that. But it was bad enough to where I couldn't really do sports or activities. And I mean, I couldn't run. I couldn't do those sorts of things at all. And I put on a bunch of weight. And I haven't really shared a lot of these, but this is from fifth grade. This is when I was starting to really expand and get big. I put on probably another 20 or 30 pounds after this picture, but I've loved Minnesota for a long time. I was from there. And I still have a lot of Minnesota t-shirts, and that was so badly fitting too. I don't know why. I don't know. I didn't think better, or mom and dad gave me a different size, but yeah. And the standard bowl cut that I had all along. But I was miserable. And I really got the fact that I didn't fit well in my skin. And I understood that I was looked at and judged differently for that. And, there's different skills we have. And I've never had like the greatest skills for reading social situations or being able to adapt well. And it shut me down. It's a tricky time in life as it was, but it really just shut me down and made me want to not participate and not do much of anything and just retreat and withdraw. We didn't really have a word for fat shaming back in the early 70s because it was just what you did. It was nothing special about it. It was just normal, Now, thankfully, we've got terms for it because it's less acceptable, but it was much more unusual to see heavier people then. And it was a difficult thing, but it really led me to pursue interests in medicine and health. And it really made me not want to take my own health for granted and realize how important it was. And it also made me realize how powerful information was. I got books from the library. I read these books and they changed my life, so it really was a big thing. But throughout the rest of my life, this is something that I've managed well to a degree, but it's something that I could never ignore. If there's a such thing as a biggest gainer show as opposed to a biggest loser show, I could be a serious competitor on that. If I wanted to let the brakes off and go for it, I could gain like nobody's business. So there are those of us out there, please know that you might see someone and think, oh, they're naturally thin. And meanwhile, they might be like that duck that you don't know how hard they're paddling to keep moving. So some people you think are naturally thin are doing all they can to hang on. And that's the reality of it. So that's my story. That's why I'm excited to talk about this. And that's why it's just so life-changing. And apart from, the social stigma and the emotional stuff, that's big enough. But there's so many ways this affects our health. And I hear a lot of talk about how one can be heavy and be healthier. And that's true to a degree, but there is a point at where even if one has their blood pressure controlled, their blood sugar is good, if all those things are great, there's no escaping the fact that extra body weight is still a risk factor. We still see that those who are heavy and healthy on paper, they still have more heart disease, more cancer, more brain aging, more symptoms, more chronic disease, and more mortality. So I really respect the message of saying you can be healthy at any weight because you can be healthier at any weight. But weight is a factor. And if there are elements of that can be improved, it makes a big difference. And the exciting thing is that the health benefits do not come from hitting one's target BMI or whatever other numbers out there. The health benefits come from that first 5-10 pounds of weight loss. Because when it's done well, you get rid of the stuff that's right around the organs. Like I've got right below the word Minnesota. That's what can go away first when it's done effectively. And that's where the health benefits come in from. So then too, we think about so many symptoms, and there's some common ones that people don't always think about that are still very real. Energy is less stable. We can see that there's joint pain, depression, memory issues. I realized something. You hear about elimination diets and you hear about food allergy programs or whatnot, and all the symptoms those things help. I've come to realize that all those symptoms are the same symptoms that are related to excess body weight. Inflammation, autoimmunity, digestive problems, asthma, migraines, anxiety, skin issues, sleep apnea. So these are things people think about as being caused by eating the wrong foods. So what'll happen is someone will cut out a lot of foods and they'll say, oh, I feel better in these ways. It might just be because they lost weight. It might not always be because they cut out a big variety of foods. It might just be because their weight went down a little bit. So yeah, there's a really big overlap between these issues. I just saw a comment someone asked about insulin resistance. So for sure, weight is a big factor in insulin resistance. And the funny thing is that insulin resistance is thought of as a disease. It's an adaptation. It's a healthy response. So insulin resistance is protecting your cells from getting fuel dumped inside that they're not ready for. If you imagine that you could take, a car engine and just pour gas like straight in the engine and then light it, well, you destroy the engine. It would just catch on fire. It wouldn't go faster. It wouldn't be more powerful. And our cells are the exact same way. So we've got this big, long line of different fail-safes to keep extra fuel from getting inside the cells. And one of many of those fail-safes is insulin resistance. It's not a mistake. Insulin coaxes proteins and some carbohydrates into the cells to be burned or stored. And if the cells say, hey, I can't burn that, and I sure the heck can't store anymore, the body's like, okay, we're going to ignore insulin. It's not a mistake. And it's something to where if one simply cut out carbohydrate, you could lower insulin, but you would heighten triglycerides. So we get triglyceride resistance as well. And these are all adaptive, healthy mechanisms. They're a sign something is wrong, but they're adaptive, healthy responses to something being wrong. They're the body trying to protect itself in order to keep it from being damaged. So yeah, they're not the enemy. They're a sign. They're a symptom. So I'll talk a bit more about the ins and outs of methodology and things that work for that. In terms of dietary approaches, the things I would think about the most would be things along the lines of these big truths. And the detailed ideas about food and protocols really are what I put into the metabolism reset. I realized over the, looking at all the research and personal experience, clinical experience, weight loss doesn't work when you're trying to do it every day. You can't live that way. A healthy diet will not make you drop pounds. It will not. So weight loss is something artificial. It's something that's unnatural, and it's something that's stressful for the body. So you want to do it briefly. You want to get in, do the job, and get out. And the time is probably under 6 weeks. It's somewhere around 4 weeks is definitely safe. Another thought is, I mentioned before about protein. So even when you're eating less food, you still need the protein to hold on to your muscles. That's why I really push for doing meal replacement shakes, because that's a way you can lower carbs and lower fats, but still preserve protein as a high proportion of overall food intake. There's other ways you can do it that I've written about. They are just a little more cumbersome. And the other thing is that if you're doing it with a high amount of animal proteins, then there's more of a pH load on your body. While you're losing weight, there's a lot of things being liberated from storage, a lot of metabolic acids like uric acid, purines, other metabolic waste that are coming out. And if your pH load is too high, that stuff can create gout, gallstones, kidney stones, other health issues. It's a paradox because extra body weight causes those problems, but so does rapid fat loss when the body is not at a good pH state. So that's why I love to focus on pH neutral plant-based proteins as being a bigger part of the overall caloric intake. And I mentioned before about exercise. That's why I encourage less of that during that window for targeted fat loss. So those are the big broad strokes of the metabolism reset. And I'll talk now about how we can help these things work better. And this is true in terms of what can help work better during times of rapid fat loss, like a reset, but also during the rest of everyday life, during maintenance, how we can prevent a lot of regain. So this next section will be about phytonutrients and about the specific things they can do. Some of the highlighted categories are that they can change basal metabolic rate, they can diminish appetite, they may help the liver break down fat more readily, and they can also change the absorption of fuel-rich molecules, specifically fat and carbohydrate. And this is a thing to where I've thought back and forth, and in a lot of cases we get into moralistic arguments about, well, you shouldn't take a pill for it. Well, yeah, stimulant type pills, there's a lot of things out there that just are not effective strategies. They may cause side effects. A lot of common ones can cause malabsorption or digestive problems. But if there are things that are safe, if they can complement reasonable steps, if they don't create rebound issues for the body, then I would say, why not do what can help? This is a tough endeavor, even when it goes well. So any safe advantage, I think one can make themselves availed of. And we've got good data from quality studies showing that there are things that can help. So moving forward, I'm going to talk about 5 different key phytonutrients. And all this is based upon specifically human placebo-controlled outcome studies. I don't put weight on animal studies. I don't put weight on uncontrolled studies. That's a study where they'll give a bunch of people something and see what happens. But you've got to compare it to the baseline. You've got to compare it to what would happen had they not done that thing. And you've really got to compare it to placebo. Because if you give people pills, they get better or they have symptoms, they have things happen that just because they're taking pills. It's a big factor. So I really want to base things on high quality evidence only. And even further than that, I like things that have a large number of studies like that. And let's go deeper. I'm looking for things that have been shown to be useful for those with thyroid disease. So that's been my focus in weeding through research. And with those filters in place, you come with a list that I come up with. There's a lot of other weight loss supplements that have been talked about, and they're not on this list because they didn't fit those criteria. They didn't cause lasting fat loss. They caused substantial side effects. They disrupted thyroid function. They didn't have quality human studies. My thought is that you want to figure out what's going to work the best, and you want to do that. If you do a whole lot of things that might work, have weak data, well, now you're diluting your results. Now you're taking like 5 good ingredients and adding in 20 lame ingredients. It's not going to taste good. It's not going to taste as good as the 5 quality things. So I want to know what's going to be most effective, and I want to focus hard on that. So for starters, I'm going to talk about something that we know about, but there's different versions of that are different than what's typical. And this is cayenne pepper extract. So we know this can work in a lot of different ways, and we've got controlled data around this. Some of the biggest effects are those on thermogenesis and basal metabolic rate, satiety, which surprised me, and then also on inhibiting lipase. So this can be culinary cayenne, but there are also extracts from subspecies that work differently. And there's a really good synopsis about what this does in the body based upon human studies. So adipogenesis, so in white adipose tissue. So that means the growth of new fat cells. So one reason we can gain weight is because we can grow new fat cells. So capsaicin can inhibit the pathways that allow that to occur. We also know that it acts directly on the hypothalamus. So this is even more central to our regulation than the pituitary gland is. This is like the master switch of the whole body. And this can affect satiety, can rate, we fill up faster, we're less hungry, we're less leptin resistant. We also know this can act upon brown adipose tissue activity. We think a lot about the white fat. Well, there's also brown fat. We don't have a lot of it as adults, but we have some. And the white and the brown. So you got some turkey at Thanksgiving. You got white meat and dark meat, right? Anyone know the difference between the two at a cellular level? It comes down to mitochondrial density. So dark meat has a greater density of mitochondria, and that makes it darker. You can actually see that color change. And so too with brown adipose tissue. So brown adipose tissue is brown because it's got more mitochondria. And what it can do is it can just like crank out heat and energy without having to store fuel. And therefore, it can regulate the growth of the white adipose tissue. It's kind of like the shepherd of the sheep, so to speak. But cayenne can upregulate the activity of it and help the breakdown of existing white adipose tissue. We also know that it acts on many of the gut hormones and peptides that regulate metabolism and satiety. Next up I want to mention is choline. I'm going to move some things so I can see my notes a little bit better here. A little rearranging briefly. Okay. There we go. I move my screen up again. Okay. This is a cool thing. So this is actually a B vitamin-like nutrient. It's not one of the numbered B vitamins. We discovered the B vitamins in a certain order, and there's a lot of gaps because a lot of things that we thought were a B vitamin turned out to be nothing there. So we go B1, B2, B3, B4, B5, B6. We have a B7, but we don't have a B8. So yeah, but choline is really considered a B vitamin now, and it's a central part of fat transport and fat metabolism. So the body can produce some. We get it from our diets as well, but it's conditionally essential. We often cannot produce full amounts. When we're menopausal, we cannot produce it as well. There's a connection by which estrogen can help us make it. So when estrogen is much lower, we can't produce it as well. Alcohol use can also inhibit that, as can quite substantial amounts of exercise. In a recent human clinical trial, it was shown that judicious, safe uses of choline could radically change leptin metabolism. And what that did was cause big improvements to body fat percent and body mass index and total fat loss. So we see this to be clinically relevant for helping to be better outcomes for people. Next up, I've mentioned this one before, but I can't not bring it in here because there's so much good data about this helping thyroid disease. This is our friend nigella, also called black cumin or black seed oil. This has been a culinary staple in the Middle East for millennia. And it's black, it's dark. Think about like blueberries or black rice. These things are highly pigmented. They're rich in powerful anthocyanins. And in human clinical trials of those with thyroid disease, this stuff was shown to help weight loss become spontaneous. So the study I'm referring to was not a weight loss trial per se. They weren't having people reduce their food intake, but they saw spontaneous reductions in waist circumference, less hip circumference, body mass index, total weight, and better thyroid hormone output. So tons and tons of wins. And here was an image that was just summarizing some of these effects. So thymoquinone, that's up here. That's thought to be one of the more active alkaloids from nigella. We know that it can help the body heighten T3 secretion while lowering TSH, decrease VEGF, which is a marker of excess vascularity that is a precursor to thyroid cancer. We know that it can help with diminishing body weight, with inhibiting the growth of fat cells, speeding the breakdown of fat cells, offsetting insulin resistance, inflammation, oxidative stress. These are all effects that it can have, which is why it earned a place for our discussion. Okay, 3 more to talk about, and then we'll move on to the next section here. Good old magnesium. So we see this in a lot of foods. Brown rice, spinach, oats are great versions of that. This can improve upon glucose metabolism, help sleep quality, lower inflammatory load, and we know that it cuts the odds of developing fatty liver. If you see my work from Metabolism Reset, you know that I talk a lot about fatty liver. Those that struggle with weight pretty much always have some version of fatty liver, even if they don't know it. Even if they're not heavy, even if it's more so a matter of just feeling flabby, like not lean enough. It's very common, and studies have shown that 40% of the healthiest adults can have early versions of fatty liver. So it's nearly ubiquitous. So the things that affect liver function are pivotal towards effective weight loss. If the body can't properly break down stored fat in the liver, we can't break down stored fat anywhere else either. So the liver is where fat loss has to start. And if it can't happen there, it won't happen anywhere else. Zinc, this is a cool thing. So there was a double-blind placebo-controlled study about people that had hypothyroidism and weight struggles. And it was shown that reasonable zinc supplementation made weight loss occur more readily. It helped offset insulin resistance. Also that it would prevent the development and progression of fatty liver disease, and reduce waist circumference and hip circumference, as well as inflammatory markers like C-reactive protein. So yeah, it's a powerful thing. I just saw a question about bioavailable choline. There are distinctions on how it absorbs for sure and the types that are used and what it's combined with. And that has gone into the formulation of metabolism boost for sure. And the last one, this is one that we don't hear about as much, but the data on it is just mind-bogglingly positive. White kidney bean extract. Many large controlled human studies. This stuff makes everything go easier with weight loss. And why is that? Well, there's a lot of theories and mechanisms. We know that there's this ratio of Bacteroides to Firmicutes bacteria. And the more that we have Bacteroides dominant, the more we'll see struggles with weight. And white kidney bean has been specific for helping to shift that ratio. So this is a lot of stuff on the slide, so forgive me for that. But each row represents a group of human clinical trials, not just a study, but a group of trials. These were randomized controlled trials. They were open studies. They were, double-blind crossovers for various durations of time. And the effects that they produced, so less body weight, less body mass index, lower body fat, lower waist circumference, lower blood pressure, lower cholesterol. We're seeing these same results over and over and over again. Lower triglycerides, waist circumference, fat mass, decreased fat percent, lower blood sugar after meals, quicker regulation of glucose, added to food, lowering the glycemic index of a certain meal, lower thigh circumference. So all findings have been shown up over and over again from large numbers of high quality human clinical studies. I was more indifferent about supplements towards benefiting weight loss before I did a deep dive in this literature a couple of years ago. Again, there's a lot of popular things people talk about in the market, such as we think about like raspberry ketones or chitosan or apple cider vinegar, a lot of stuff out there. And some of the things are fine and harmless enough, but honestly, just the data is only from animal studies or it's anecdotal or it's just not been reproducible. So yeah, a lot of things have been out there that are available, but I wanted to home in on what's effective, what's going to make a difference for those with thyroid disease, what's safe, and what's compatible with other things that you might be doing. So after pouring through all that and filtering through, no exaggeration, thousands of studies, these are the things that I came up with. And this was the blend that became Metabolism Boost. We've got biologically available choline. We've got a therapeutic dose of these active bioflavonoids and the key micronutrients. Now, this was made to complement the thyroid daily. So it's basically something to where with it for the remaining micronutrients, these will complement it, but not become excessive. And that's even true if someone is on also, say, antibody support or nodule control. They're not going to get redundant amounts of things. I've thought all this through so they're safe to combine. In terms of using this is simple stuff. This is not a stimulant that won't keep anyone awake, won't give you the jitters, it won't give you diarrhea. There's a term, fecal incontinence. So a lot of common diet compounds like Olestra have a side effect of fecal incontinence, which means you get uncontrollable diarrhea. We're not goofing with your gut. We're actually improving your gut flora to make it more effective with that. And it's just 2 once daily. Now, like anything, you want it at least an hour after thyroid medication so that the meds can absorb properly. And in terms of this with the metabolism reset diet, you can do this on either phase, whether you're on the reset phase or the maintenance phase. So you can do this to help have more fat loss occur during the active reset. And you can use this to help things stay off when the reset has stopped and you're back onto maintenance. So fine both ways on this. So yeah, and during the maintenance, there's a lot of guidelines on making that work better as well. So main 3 steps, look at the MRD, please, for some strategies and ideas. Keep thyroid levels healthy. You don't want too much or too little. And Metabolism Boost, you can use this in both ways for safety and good benefits. We've got ingredients showing that they help waist circumference come down. They help fat loss become easier. We see that they improve the activity of the liver function for breaking down stored fats. We can see that overall brown adipose tissue gets better. These are all things that are complementary. And some work by similar mechanisms, but they also work by different mechanisms. And all together, they make things more effective for fat loss. And there's large studies attesting to that, such as all of these for just one of the ingredients. So really excited to have another tool in the kit, another tool in the box available, because this is a big deal. This is like so critical for all of us. Almost every unexplained symptom. And I see many people to where they'll have some of these symptoms. And of course, many other things can cause those symptoms as well. I don't want to say that they can't. But when someone is struggling with their weight and they've got these symptoms, there may be that might be all there is to it. There might not be other causes behind that. It's really common. Someone says, well, why am I tired? Why do my joints hurt? It might just be the weight. You'd want to certainly make sure of any other obvious factors and take care of them. But that if someone also has more weight than they wish, that by itself can be the explanation. It may not have to be anything more mysterious than that. And yeah, there's few things one can do to improve their overall health, their well-being, their symptoms, their lifespan. I just can't overemphasize the benefits that can come from that. And that's not to say that it's easy. I acknowledge that it's not. And it does take some ongoing vigilance. But I want you to think that it's possible. I want you to know that it can be done. Just because it's hard, just because it hasn't worked in the past, think about someone who talks about quitting smoking. They could say, well, I've tried a dozen times and nothing worked. Well, doesn't mean that it wouldn't work. It might be the 13th time. And that doesn't mean that it's easy, but it's still worthwhile and it's still possible. And if this is one thing that can make it just even a little bit more possible, then that's a huge, huge win. So that's enough of me rambling. Okay. So now I'm going to go to some Q&A. And a couple platforms I'm with you guys on, Facebook, Instagram. So Instagram is going to pull the curtain only at the hour mark. That's not too far away. So I'll wrap things up there a bit sooner and hang out longer with the Zoom crew just because I have to. So one quick one I saw is that good group of supplements would be Thyroid Daily, Metabolism Boost. Is that correct for weight? It would. The Thyroid Daily, I'd even say in the context of the Daily Reset bundle. And I should have said that because then that also encompasses calcium, magnesium, and essential fats. That's basically all the needed micronutrients and then the metabolism boost. So yep, that's the best blend for weight. If there are also thyroid issues, there may be a time to where something could help that go better. But if there are not, it's just the weight, and that's exactly what I would recommend. Okay, so I'm going to stop the screen share. So my friends in Instagram, I can hear the questions when they come in, and I apologize. You won't hear those, but I will repeat those. So, and if you're asking a question, forgive me if I break up every now and then just to share the question as we go with the rest of the audience. So follow-up question about the package hypothyroidism, then think about antibody support for a good complement as well, because that can benefit overall thyroid hormone production. So a lot of hands are up. I'm going to take these in order of which they came in. And again, I'm going to really struggle trying to do a lot of questions, but do a really good job with the questions. So if you don't mind, just have your questions a sentence or two, and I will be very thorough and very comprehensive. So what's going to happen is I will hit unmute. You'll see that. Unmute yourself. I'll lower hand. We'll go for it. And I'll just pause every now and then so I can share the question with those who wouldn't hear the audio. All right, let me get my list up here. And there it is. And it looks like Bonnie is first up. So Bonnie, it's all you. Oh, one more quick thing, if you don't mind. I'm clumsy on Zoom. And if you have a tough time finding how to get the mic to work, know that you're in good company. If I can't hear you for a while, I will go to the next question. Raise your hand again. I'll try to come back to you afterward. But if you get technical difficulties, it happens. No worries. So Bonnie, you're up.
Hi, Dr. Christensen. Thank you so much for taking my question. I've actually got two questions. I'm sorry, I've got my phone on.
Bonnie's got two questions for us.
Okay, so I've heard you say that thyroid disease can be reversed.
Mm-hmm. Bonnie, heard me say thyroid disease can be reversed.
My TSH over the past 15 years, yes, I've been checking it for 15 years, has gone from 2.03, and then it went down, then it went up and down and up again. I actually had a thyroid panel done today. And it's now at 2.91, but over the summer when I had some thyroid tests done, my antibody, let's see here, the TPA was positive. It was at 32. It had never been measured before. So I'm wondering if I have a positive, if that number is existent.
So the first question is what then?
The question is, am I doomed with having the positive bodies?
Okay. So was Bonnie doomed to have her thyroid shut down because she's got positive thyroid peroxidase antibodies and her TSH is in the 2 to 3 range? The short answer is no, you're not doomed. So if you did nothing smart whatsoever and you were just a random person living your life, your odds, your 9-year odds of having your thyroid shut down because of your levels are 11%. So if you do nothing whatsoever that's smart, you've got about 11 chance over 9 years, which is what? Not far from 1% per year of having your thyroid shut down completely. So that's pretty good. Now, in terms of things you can do, think through about the thyroid reset diet, those big action steps there. Think about the daily reset bundle, antibody support as an option, but those can improve your odds even further. But your baseline odds are pretty fair. You're not doomed by any means.
There was a short period of time when I was taking kelp, and then I read your book. Actually,
I'm glad it was a short period.
It was actually like a year.
Okay.
I've done some permanent damage to my thyroid.
So given your current levels, you would not have. You should be in a state where things come around. Okay. So question 2, what would that one be?
Question 2 is actually related to skin cancer. I'm in a position now where I'm dealing with skin cancer. I'm actually treating my lip now with Aldera, which is a topical immuno something or other drug. And my doctor is really pushing for me to have radiation on my nose, which is squamous.
I'm not an expert.
Okay, but I did read that radiation can affect the thyroid. Have you heard of that before? Or do you have any?
So radiation is a huge, huge topic. And if your thyroid is locally irradiated, as was done in the past for things like tonsillitis, or if someone's exposed to massive amounts and like industrial reactions or whatnot, but amounts for other procedures, localized procedures, really haven't been shown to be a big factor. So respect.
He wants to do 20 visits on my nose.
You'd have to really check with him to be sure. I wouldn't suspect that'd be an issue, but he could give you better feedback on that.
Okay, super helpful. Thank you so much.
You're sure welcome. You take care of yourself.
Thank you. You too.
Okay, so let's see. Next up, we've got Aisha with us. I've seen you here before a few times, or at least on social media. So welcome.
Hi.
Hey, how you doing?
I'm good. And you said my name correctly. I know on social media, I was like,
I stumble sometimes. I'm sorry.
That's okay.
I'm learning. I'm slow, but I catch on.
So I was on yesterday, and I'm the one that asked the question about hypo/hyper and then autoimmune. It's like really confusing.
Did that make sense at all? Or
it did. But I'm very confused on what supplements that I should take from you. So just really quick, like in a 5-year period, I went from first being diagnosed with hypothyroid, but not bad enough to be put on medication. That's what they told me. Then I was told I had Hashimoto's, but not bad enough to be put on medication. And then I had that thyroid scan. I think the iodine something thyroid scan.
Iodine uptake scan,
That's when I was told I had Graves' disease.
Okay.
So I was put on medication, and I buckled down and ate really well and did my research and read your books and got off my medication within 6 months. So I've been off my medication for maybe about 1.5 years now. So I went and got labs just to kind of see where I was at. And so I was told that my Graves is okay, but they mentioned thyroid autoimmune, and that's why I made that question yesterday. So I'm like so confused. I mean, I have my labs here, but I'm like, I don't know what I have anymore.
I'm sorry, I've not been doing a good job keeping up my audio. So Aisha's had a history of being hypo in the past. She was told she had Hashimoto's after that. She was then told she had Graves' disease. She was put on treatment for it. She did the thyroid reset type guidelines, didn't need medication for that, and now just not sure what to do. All things together, if you did have Graves before and you were treated, I'm assuming like with imazole, tapazole,
Yes.
or I would do hyperthyroid support and then the daily reset bundle. If you were told you had Hashimoto's, you can include the antibody support as well. It's really common to have Graves with Hashimoto's antibodies. And this is worth doing something about because given the presence of both types of antibodies, what that means is Graves' remission is more likely to slip into returning hypothyroidism. You've got greater odds of it slowing down more than you want it to slow down. If someone has Graves' antibodies and they lack thyroid peroxidase antibodies and they lack thyroglobulin antibodies, they're more likely to stay into remission and not become hypo. But when someone does also have Hashimoto's antibodies, they've got greater odds of going from hypo to normal and then back down to hypo again. So that's exactly a good concern. And I would think about the antibody support, the hyper support, and then the daily reset bundle as being the best fit in a situation like that. Someone else is just popping up saying, that's me too, Graves with Hashi antibodies. And that totally happens. That's a common manifestation of Graves. The really bizarre thing, you guys, is that Graves' disease and Hashimoto's are like a molecule apart. They're almost the exact same thing. So with Hashimoto's, you're attacking something inside the thyroid. With Graves, you're attacking something that's right outside the thyroid that's almost the same thing. I think about it like a short circuit on the doorbell. When it works well, you hear the doorbell and you open the door. You let the dog out, you do whatever. But with Graves' disease, there's no one there, but the doorbell's going off. So what's going on chemically is that TSH is your brain thyroid stimulating hormone. It's your pituitary stimulating your thyroid to work. And it works. TSH is also called thyroid. So one of the games in medicine is that everything has to have 10 names, so we're all kept confused. So TSH, other name is thyrotropin for no good reason. So there's thyrotropin receptors outside the thyroid. Those are the doorbells. So when the thyrotropin receptor gets hit, your thyroid says, oh, that means the brain made TSH. That means I got to crank out some more hormone. Now with Graves' disease, there's a thing called thyroid stimulating immunoglobulins. And what those do is they hit the doorbell. They're not TSH, but think about the acronym TSI. It's so darn close, your body can't tell the difference, So your body thinks you're telling your thyroid to work, even if you're not telling it to work. So that's why you get too much hormone out of it. And it's almost the same molecule as thyroglobulin inside the thyroid that makes the backbone for the hormones. So it's really common to have those things overlap.
Okay. Can you also take the metabolism boost? Because I hit menopause right in the middle of all this. So I got double whammied.
You sure can. There's no drawbacks. And I put so much thought into that because a lot of things do become redundant, but those will not.
Okay. All right. Thank you.
You're sure welcome. Okay. Let me remute. And Amelia, you are up next. I want to get a bunch more questions tonight. Let me do what I can do here. So where are we at on time? So dear friends on Instagram, looks like Josh is with y'all. I know we're about to drop here in just a moment or two. So I'm just going to do that preemptively so it doesn't cut off like mid-sentence and I'm making a funny face or something. So thank you guys for being with us. You can still hit the link over on drchristiansen.com and come on over and join us in that world if you do wish to. And we're going to keep on hanging out here for another bit more. We'll see. All right. Good night, Instagram and everyone else. Okay. We're still going. And next up is Amelia. So Amelia, I'm going to ask you to unmute and go for it. Let's hear your question.
Yes, I've been taking the daily resets and I'm going to be switching. I was going to be switching over to the new daily resets, but had thyroid removed due to cancer. So I just found out that I'm pregnant and I need to have prenatal vitamins. My doctor wanted me to just go buy a prenatal vitamin, but when I did, I noticed they have iodine in them, and I'm concerned about what I should be taking.
The daily reset bundle is still totally appropriate for you, Amelia. Yeah, you're all good that way. The funny thing, but prenatals have been studied specifically about whether iodine is warranted and then how much iodine is present. And one paper, they took 120 popular prenatals and they just bought them like you or I would, and they brought them back to a laboratory and they analyzed them. And I'm sorry, they randomly selected this group of 120, and out of those, they chose 62 to analyze. They didn't analyze all 120, but out of the ones they analyzed, there wasn't one that was within 5% of its labeled iodine content. A lot of them had 3 to 4 times as much. So there was a big paper that came out in the last 6 months. And what it showed was that you do need a little more iodine during pregnancy, but it's not as much as we used to think. And the idea about getting too little, what I encourage during pregnancy is to add in deliberately 1 or 2 of the yellow light foods. Do you have the Reset Diet book already? Or
yes.
Okay, so yeah, the yellow light foods per the serving size, include 1 or 2 of those. And that way that'll be enough to keep you in that healthy 150 to 250 microgram range. But otherwise, you wouldn't want it in supplements because you're going to get a whole lot more than you would expect. The other big thought about pregnancy is methylated folate, and the Daily Reset Bundle is appropriate that way as well.
So that's like the folic acid that is needed for pregnancy?
Exactly.
Okay. And then what about calcium? Because I have problems with parathyroid because of my surgery. So what about I'm not able to recently. I haven't been able to take my calcium. It's upsetting me. So would I just take that new calcium that you have, or the old one?
The bundle would include it. And that's a calcium citrate. That's an appropriate one. So there's parathyroid function and there's calcium upsetting you. Now, with hyperparathyroid disease, you can have hypercalcemia. You can have too much calcium in the blood. And then more rarely with hypoparathyroid disease, there's not enough. The body doesn't really bring it in quite as well. You had thyroid surgery, but was your parathyroid function altered from surgery that you're aware of?
Yes. It was. The calcium levels were low, and then they got them kind of regulated, and then they've gone low a couple of other times since then. Okay.
So in those cases, the calcium is even more critical for you because if anything, you may be a little low on parathyroid hormone, which helps calcium uptake. So you do want to be getting good amounts of a variety of dietary sources and amounts like that calcium citrate. You say it bothered you. Were there certain types or certain doses that bothered you?
It just kind of the calcium magnesium, the extra bottle that I was taking of yours was bothering me. Just recently in the last couple of weeks.
Couple thoughts. If it were, sometimes that can be better if it's more spread out. So the newer one, it's 3 pills per day, and you can spread those out like one with a meal. And another trick is that if you do make any smoothies at all, you can even add that to smoothies. The more it's emulsified and well mixed with food and other things, the less apt it is to bother you.
Okay, great.
But it's important for you. You're welcome.
Thank you.
Okay. Next up is Sandy. This is a good group, you guys. I'm having a lot of fun here. So, Sandy, what have you got for us?
Great. Hi.
There you go. Hey, Sandy.
Hi. Good to see you.
Good to see you too.
Okay, so I was wondering what kind of magnesium you use in your supplements. Is it always magnesium oxide?
It's not. It's magnesium citrate in the Daily Reset Bundle. Magnesium oxide is fine as well for some purposes, especially for metabolism. In terms of more as a basal micronutrient, there's more data around citrate. Yeah, different forms have different research for different purposes, which is kind of fascinating.
Okay.
And my thought is that when there's a clinical trial showing that this type had this particular effect, I want to mimic those effects as much as possible. So some of the studies I cited about liver fat and breaking that down, those were on magnesium oxide. That's a form that's a little bit more concentrated, which is nice about it. It's been known to have those effects more specifically.
Magnesium in all forms that I've tried so far have caused diarrhea for me.
They can. In a lot of cases, that's dose related. You might even see how you do with more reasonable amounts. And as I said earlier, too, also with food can make a big difference, but that's a good way to try it.
Yeah, I've tried oil even, just putting like a tiny bit on my neck, and I'll still get diarrhea the next day. So
something just certainly be aware of. Some things are better fit for you than others.
Yeah. And I want to thank you for the tip on resistant starch for sleep. I've had insomnia for 30 or 40 years, and the last couple of nights I've tried having a resistant starch before I go to bed, and I have slept great.
That's awesome. I'm glad to hear that.
I know.
That's wonderful news.
All the many years I've had insomnia, I wish I would have known it was that simple.
Well, that's super great news. Thank you for sharing that.
I am allergic to nightshades, solanine, dairy, nuts, eggs. I can't take vitamin C. I can't take vitamin D. The C and the D, they give me tachycardia. And the nightshades make me itch. And on and on. So there's a lot of things that I can't use. Like the one you mentioned tonight, he had some kind of cayenne pepper in it. Well, that's got solanine in it, so I couldn't take that. So it's just hard to find something you can use.
Do what you can. Do what you can. What happens is that there's two ways to go. If your body seems to be sensitive, one way is to always cut out what you seem to be reactive to and keep on getting on a shorter and shorter list. The difficulty is that sometimes you find yourself getting even more and more sensitive because of that, because your body has less variety. So what I would always encourage is that, you've got to be reasonable, and you can't do things that are going to be harmful or make you too miserable. But I would always just push the envelope very gently. If there's some things you can tolerate in tiny, tiny amounts, I would encourage you to have those things. And other things you haven't tolerated, maybe you can in the future. Maybe your sensitivities can diminish or change over time. So I'd always just, even with like the tiniest amounts, just keep testing things safely and keep letting your body get more variety rather than less.
Yeah. I was trying to take progesterone oil, and I just couldn't tolerate it at all. So my functional medicine doctor told me to just try 1 drop, see if that would work. 1 drop on my skin. I couldn't even tolerate 1 drop.
Okay. Yeah. Well, I'm glad the RS was better. Was there a question I could still get along with that one, or?
Yeah, I guess I just don't ever know what they have to do.
I just saw a comment pop in about someone trying acupuncture, and I think that's a great idea. I've seen people that are very sensitive to where acupuncture, energetic type therapies can be really nice. If there's things you can't do that well orally, sometimes your body can help shift your state in ways to become more tolerant. That's a good thing to think about.
Yeah, I have done acupuncture in the past, but I could try it again for that.
That's a great idea.
I don't want to keep. Thank you very much.
Thanks, Sandy. Have a good night.
Thank you.
Okay, Claire, you are up. Let's see what you have for us this evening.
Hi, Dr. C. Thank you so much for taking my question.
My pleasure.
I actually had one thought process, but Aisha's question kind of threw me for a loop because I'm so glad she asked her question.
Well, hypo and hyper and different antibodies, or?
I have active Graves' disease, and I have had it for years, and I always just thought I had Graves. That was it. And then, but I ran to my chart to look to see what antibodies I have. I have
sure enough,
thyroid peroxidase antibodies, high thyroglobulin antibodies, and the TSI.
Okay.
All of that's high. I do have the specific values, but they're all high.
Okay.
Does that put me in that category of Graves, but also Hashimoto's?
Well, it means there's more of a risk when things do resolve of lapsing into a hypo state. That when the Graves, the funny thing is that the thyroid stimulating immunoglobulins, they're driven by hyperthyroidism. That's kind of a weird concept, but they cause hyperthyroidism, but they're also driven by hyperthyroidism. So once things get up to speed, those two things spiral upon themselves. It's called the hyperthyroid autoimmune loop. Now, the good news is the reverse is also true. So when someone's not hyperthyroid for some length of time, the TSI often does lag behind and come down. When there are high Hashimoto's antibodies, that coming down can keep on drifting past normal function and go to hypo. And that's just the main consideration. So the benefit of doing things to help the antibodies and help cut the complication risks is that you're more likely to resolve and become euthyroid, euthyroid, which means normal, and you're less likely to lapse into hypothyroid. So you could also consider the hyper support as well as the antibody support.
Well, and I already purchased the hyperthyroid support, and I am in the process. I'm getting it in the mail, so I'm going to start it. A year ago, I was at my ideal weight. Unfortunately, I'm about 12 pounds up, and it's really bothering me. So I was interested in the metabolism boost as well. But based on Aisha's question and your response, I'm wondering about that antibody support, adding that. Is that something I would need to take long term?
Wouldn't need long term. In a lot of cases, do think about the thyroid reset diet guidelines as well. But with that and those other steps, there's a really good chance of the Hashimoto's process really reversing itself and stabilizing. Many do see that.
I wanted to start off slow. So I was thinking the hyperthyroid support and the metabolism boost to start off. Is the antibody support something I should put in now? Like, is that priority wise? Is the antibody support really important while I'm in active Graves' disease?
Well, so the thought process there is it can take some time for full resolution. So if we could get a head start on that and have it to where they were diminishing as the Graves was improving, that would help your odds of them already being in place so you wouldn't lapse into hypo.
And do you have markers that you look at to where you can come off the antibody support? Do you
just antibodies staying negligible enough for a period of 6 months? Yeah.
Okay. All right. Well, thank you so much. I appreciate your time.
You're welcome. Good luck with everything.
Thanks, Aisha.
Okay. So we've got Felicia now. I want to get several more questions here. I think we just did do Claire. I didn't lower the hand properly. I'm sorry. So it is Felicia that's up next. So Felicia, okay, asked to unmute and it's all you.
Hey, Dr.C. I have a specific question. Hey, I have a specific question here about the metabolism reset diet. I am following everything to the letter, and I'm so excited about the new products because I've got the daily bundle coming. I've got metabolism boost coming, and I do your reset shakes. And there was one other thing. Anyway, I'm so excited for all those to arrive. But my body is holding on to every inch and every weight, and it will not budge. And I'm keeping the faith and I'm staying strong, but I'm not waking up feeling rested at all. And I feel like it has something to do with my sleep. So my question is how many times can you, because earlier you said weight loss isn't forever, it's about a 4 to 6 window. So how many times can I back to back do MRD safely? Because I'm good at about 155 pounds. I'm 5'7", and right now I'm 230, and it's very, very devastating. And I do not want to live in this size body, and it's just won't budge.
Sure. Did you catch the last week's discussion about sleep and some of the sleep hygiene tips and whatnot? And
I still need to watch that. So that's on my list.
Yeah, grab that one. And, it was a funny thing. There were some questions I had about people saying they had tried everything. And that's how we think. We try a lot, But I said, well, okay, these 5 things I talked about, do you do all these right now? Well, no. Okay, do those. So there's some stuff I said that some of it, I think a lot of it will be new. Some of it might not be new. But do the key steps. They're really big. And thyrotonin can be an option as well. But you're spot on. Sleep can be a big factor. Now, to directly address your question, so per year, it's safe to do 4 reset cycles. And you'd want a minimum of a 2-week gap between each cycle. So some would do those like quarterly. Some want to like really jam through it. But you want at least 2 weeks off between each cycle and max of 4 per year.
Okay. But I mean, it would be safe to do. So, in all reality, I don't know if I'll do them back to back to back to back like that.
Sure.
But what I'm saying,
do like quarterly or something, or.
But whenever you say it's really weight loss only 4 to 6 weeks. Are you specifically talking about the 28-day MRD, or are you saying like if I do the thyrotonin and get on my supplements and I get my sleep in and I'm doing all the things, when I slip into maintenance phase, can I still lose body fat if I'm doing everything right in the maintenance phase in between each MRD?
So what you said was that you've got a bit of distance between where you are and where you want to be. And the funny paradox is in those cases, you may see some more spontaneous weight loss during maintenance. The closer someone is to their target, the less common that is, but you could well see that. But yeah, as you get closer, it's more common to only see weight loss occur during that reset phase. But yeah, that's entirely possible.
Okay. And I did order the thyrotonin as well, because I'm like, I want to get rested and feel like, use all the best tools as possible to get the best outcome.
Check out last week. If nothing else, play that late at night and my voice will put you to sleep.
Okay, I will.
If the information is not helpful, at least that should be.
No, I need to listen to that one. So thank you very much. And thank you for all your just encouragement and inspiration. We appreciate it.
You're sure welcome. Thank you for the feedback.
Yes.
Okay, so let's get a couple more here. Michelle is next up. Michelle, I don't know if there's more than one Michelle, but Michelle, I'm going to ask to unmute. It just says Michelle, no last initial. And so go for that.
Hi, Dr. C.
Hey, Michelle, everyone's hiding from me now. Is this the thing or?
I'm not, I'm just,
it's okay.
I have no, it's my video, my camera. Don't ask.
No worries.
I would love to see you in person. I have 2 questions specifically about the Metabolism Boost supplement.
Mm-hmm.
I'm curious to know, before you began to sell the supplement, did you have any personal, professional experience with it, like using it in your clinic with patients, or perhaps a little study that you did? And if so, I was curious to know what results you saw.
Sure. Yeah. The ingredients individually, yes, such as especially the nigella. I had used that for other reasons and did notice many talk about spontaneous weight loss. The white kidney bean extract by itself also, and also the cayenne. And then I alluded to the independently done, just controlled studies. It's a funny thing. I always love to see both. The hard science is the hard science. It's always the most weighty and the most meaningful. But I did have clinical experience with those as well. The zinc and the magnesium are things that I often would see in part of people already being on the reset pack. So I couldn't have said that I saw those work individually, but we know that in amounts a little bit higher, they do have some advantages. So apart from those 2, the others, I did have clinical experience in addition to the trials that I mentioned.
Okay, so you were seeing sort of, real-time evidence that what the studies were claiming was happening with the people in your clinic.
You're exactly right.
Okay, that's a double check mark for me. I like that. And the other thing I'm curious about is if you have any information or recommendations for those of us who are going to start the Metabolism Boost supplement when we finally get it, as to what longer term use would be. Do we continue it until X? If something happens, should we hold it? If something happens, should we discontinue it? Because we all wish we could have continuous access to you for the rest of our lives, but we know that this series is going to come to an end soon, and then I don't know who to ask that question.
I'll always be available. So I'll do office hours, I'll do other things. And, I was just thinking to myself sometime in the last several minutes, that I want to do more things like this as well. So I'll figure out some excuse to keep myself available. But to answer your question though, definitely during stages of active weight loss. And, if you've hit maintenance phase and it's smooth sailing for 6 months, things are all good, you could let it go by the wayside. That'd be quite reasonable. But if there's still some ways in which things are difficult, it's safe to stay on. They're all ingredients that are considered GRAS, generally recognized as safe. And I'm thinking through the list real quick. So pregnancy, lactation, these are all things that are in food, but they've not been studied specifically in those contexts. But otherwise, they're fine things to use as needed.
Okay, so common sense prevails.
Yep.
If we don't need to lose any more weight, which will never happen, but we will just use our common sense then. Great. I just wanted to know whether that was safe to do.
Very much so. Good questions.
Great. Thank you again so very much.
You're welcome, Michelle. Okay, so now we've got Tara. Let's hear Tara's question here this evening. And I want to get a couple more. I'm not sure if I get every single one, but let me get a couple more at least. So Tara, let's hear what you have for us.
Hello, can you hear me?
I sure can. How you doing this evening? I'm so sorry. I lost your audio real quick there. It looks like you just remuted, it looks like. Your video is going good. Now your video is gone. And the audio is gone. Okay, now the video is back. But I see that the mute is activated on your end. It shows that mute icon. Let me see. I don't think it was on my end, but I'm going to go find your name and hit ask to unmute again. Maybe that'll be helpful. Okay, there you are. Okay, ask to unmute. Okay. Now, between us, we got it.
All right, good. A couple of things. I have your Thyroid Reset diet book. I've been following that. For the last couple of months, my TSH has been very suppressed, below less than 0.015.
Okay.
My question is, I did order the antibody support because I've been trying LDN, but I'm not having a whole lot of luck with feeling well with that.
How so?
So I did.
You feel kind of sedated from it, or?
Yeah, real fatigued. Fatigue is one of my biggest complaints, fatigue and kind of like a depression.
Mm-hmm.
So I did order the antibody support. My question is, can you have still TPO antibodies in the hundreds and significantly reduce your thyroid medication or even come off of it?
That is possible. The funny thing is the antibodies, they certainly can be relevant, but they're not as strong of predictors as you might think. You know, they're not even what damages the thyroid, believe it or not. They're often there when the thyroid is being damaged, but they're not the thing damaging it. So you still can improve. They may come down.
I have reduced my thyroid medicine, but it keeps coming back. My TSH is very suppressed, like it's non-detectable.
Could you share what your dose and type is if you're comfortable with that? Or
I was taking 90 milligrams of NP thyroid.
Okay.
And then I was told to take 60 one day and 90 another day. So it's still coming back. So I think we're going to try straight 60 now. But my question is, I did order the antibody support, but what else would be helpful for fatigue and depression?
Yeah. So being certain that your iron is not lacking, that's a consideration. If it's off, it can be a big part of that. I'll be talking about the iron coming up pretty soon, but you may do a lot better just by your thyroid levels even normalizing. So it may not be a lot of mysterious things. You can really not feel well from that. The LDN can cause symptoms as well for some people. I don't know if you heard me talk about this before, but we finally had a big study done on it in Norway about 2 years ago. Before then, we had anecdotes, and I did a survey many years back in the late 90s for people, and that was kind of, some suggested that it lowered their antibodies, some did not. It was not very definitive, but a controlled study was recently done for the first time. They took a group of about 300 people, all on thyroid medications of various types, put them in two categories. One group got LDN, one did not. And the expectation was that LDN would cause their thyroid to work better and they would need less medication. That was very measurable. They could just see of these groups, which groups needed dose reductions, which groups didn't. And it turned out the exact opposite of what they expected, that those on LDN, the other group, the control group, had more medication reductions in the group on the LDN. The LDN didn't have benefits that way overall.
Yeah.
But there were those that were fatigued or depressed or having just excessive sleepiness throughout the daytime. And
yeah, I noticed when I skip a day or two, I do start to feel a little bit better. But I've been trying to creep up because I wanted to try to get my antibodies lower.
Well, so helping your TSH come up, that by itself may also improve your antibodies. When the TSH is far too low, there's nothing telling your thyroid to repair itself. So one more thing off the cuff, if you're on 60 NP and your TSH is still very low, your thyroid's doing a fair amount, because the average adult, so, per 100 pounds of body weight for an adult would need somewhere around 60, 75 milligrams of NP for an average woman. So, and that's if she had no thyroid. So when you're taking that much and your body's saying that's too much, that means you've got to be making some, that your thyroid isn't doing nothing, if that makes sense. Otherwise, it wouldn't be like that. Because if anyone took a big enough dose, they would always show a low TSH, right? If they took way more than their body would make. But if you're taking less than typical for your body and it's too much, you're making a bunch. So it's important to keep on stepping down. But the silver lining here is that you're doing a lot by yourself.
Yeah, I think a lot of it is from the reset diet as well, because my TSH has never been that low.
Okay.
So
that's awesome.
So I was just curious what else I should be taking or could help take besides the antibody support, or is that all for now?
Do that. Do the bundle. If weight is a concern, metabolism boost is fine. But I don't think you need a ton of things. I think that you've got a lot of benefit to come by just.
Sure. I would like to. I think I need all of it, but I don't know which ones to go with.
Here's the thing is I did the quiz on that site, and I did it to where it shows things per the priorities you selected. So it wouldn't say to anyone to take everything, even if all those things came up. It helped you figure out which are the biggest priorities. So the top 3, I would think about adding in. But I think you've got a lot of benefit by just stepping down on your thyroid as your body needs less, and then just having less medicine coming in your body overall.
Okay. Thank you very much.
You're welcome. I think you can do really good.
Thank you.
Okay. I got to get a couple more. This is fun, you guys. This is Michael, it looks like. Michael or Michael's account. Sometimes it's a different name, but we'll see what we got here. So go for it.
Yes, Dr.C.
It is Michael. How you doing?
Good. How are you?
I'm doing great. Thank you.
Excellent. I'm excited about your new cookbook there.
Thank you.
But I was wondering, what's the importance, or how important is it to look at food that's non-GMO'd, organic? Does that make a difference with your thyroid? Like my wife is gluten sensitive. She's got thyroid nodules, and we're trying to cut back on toxins in the food. Is that important?
To your thyroid, is that important? Well, I've seen no evidence as such. Now, there's never any harm being cautious and being deliberate. But I always think through what's most bang for the buck, what's most effective. So yeah, there's a lot of ways by which people can also be voting with food in terms of various industries they wish to support and wish not to support. And those are all factors. People think about environmental considerations. So those all come up. But as far as direct ways those things could or would hurt the thyroid, no data about that. Kind of a bizarre thing, pesticides specifically, I have put a fair amount of thought into that. And I have an opinion that's quite different from a lot of my peers. So pesticides, we've talked about things like thymoquinone in nigella, or we talk about like proanthocyanins from blueberries or glucosinolates from broccoli. Those are pesticides. No two ways around it. Those are pesticides. That's why they're made. And the bizarre thing is the quantities that are made in plants are probably 50,000 times greater than the quantities that get put on plants. So yeah, I for sure, whatever choices you get for the best quality food is great. But I do hear people say, my choice in terms of what my market has, what my budget offers, my choice is commercial produce or no produce. And in that case, you're better off having commercial produce than no produce. We've got mountains of studies showing that people who consume produce are healthier than those that don't. So if that's ever a stress for someone, I encourage them to get the best stuff they can get and know that having some is better than not.
Okay, that's excellent. I'm looking forward to the book.
All right. Thank you, Michael.
Yep.
Okay. Abigail, I'm going to get a couple more and see how far I can get tonight. I'm still going strong. How are we doing? I can push on a little more here. All right, Abigail, let's hear what you've got for us.
Hi, Dr.C. Thanks for taking my question. Can you hear me okay?
I sure can. You at the gym there?
Yes, I am.
Good
Hopefully
for you.
You can hear me okay.
I can hear you just fine.
Great. Well, thanks for doing this webinar. I've learned a lot from you, and actually got a lot of your books when I started first having health issues about 3.5 years ago. And that kind of started my health journey. I was diagnosed with chronic Lyme disease and mold toxicity because I lived in an apartment with black mold for a couple of years. So I've been on the journey of detoxing and healing from that the last 2 years. Just my endocrine system was really affected by that, and was diagnosed with hypothyroidism 2 years ago. And then anemia, vitamin D levels were low, and a lot of other things. But seeing improvements on the anemia, my thyroid is still not to where I think it should be. Just had a doctor's appointment with my specialist this morning, I guess. Felt longer ago than that. But my TSH in December, when we retested it, was 0.062. And
are you on medication?
Yes. So I'm taking 120 milligrams of NP thyroid, and I was on 90. We started off on 60 like a year ago, upped it to 90 last summer, and then in December upped it to 120 because of experiencing for like a month straight tons of hair loss. So I have... So the
dosage changes because of the hair loss, not because of your blood levels?
The hair loss, and then my doctor was rerunning blood levels, but after looking at my level, she still thinks I should be on 120 milligrams.
Despite the scores you told me?
Yes, I think she was upping it because of those scores.
Because your TSH was low?
I know I don't fully understand how TSH and free T3 work. I know that, if I'm understanding correctly, remembering correctly, I thought they're supposed to be like a teeter-totter unless the hypothalamus gets sick. And then it kind of gets all out of whack. So that's how she's explained it. I can't really go based off of the teeter-totter since like the mold and the Lyme.
So this is something that, I don't know, might be one of my last messages to humanity, is that view is, it's very logical, but it's completely incorrect. So the teeter-totter thing, the TSH is backward for thyroid status. When there's too much thyroid, it's low. When there's too little, it's high. And the free hormones are linear. If there's massive excesses, they're high. There's big deficiencies, there's low. However, the teeter-totter, it only works when you're at the ultimate extremes. When you're anywhere between the ultimate extremes, there's no teeter-totter. They won't do that at all. A really common thing when you've got too much thyroid hormone is that your body gets rid of thyroid hormone. And so T3 and T4 can be low or low normal. And that confuses a lot of doctors. Hypothalamic disease happens, but if you had that, you wouldn't be talking to me from the gym. You'd be on your back in the ICU somewhere. But doctors have been taught that that's a common idea in functional medicine. It's just not true. So in your case, the questions are, what really are healthy levels of T3 and T4? How do they look in healthy people? And then how about TSH?
Just to make sure I'm understanding correctly, you're saying the teeter-totter view is not a really good way to look at it unless you're dealing with extreme levels on either end.
So let's say you had a clone and your clone had her thyroid taken out and she was given nothing. The teeter-totter would work. Her TSH would go through the roof and her T3 and T4 would eventually drop off. Now let's take another clone and let's take this one and let's give her 20 of your 120 milligram NP thyroid pills. Over the course of 8 weeks, her teeter-totter would work. Her TSH would plummet right away, and eventually her T3 and T4 would be through the roof. But between the extremes, the teeter-totter does not work. In many cases, it'll look the exact opposite of what someone would think. And what happens is your body adapts. So the first thing you do is you adjust your TSH accordingly. You say, I want more, I want less. But you also have a million ways, not a million, but you got a lot of ways you can manipulate T3 and T4 to try to put them where you want them. So when you've got too much, you fight those hormones. When you've got too little, you hold on to those hormones. So it's only when your body is complete, when all those backup things have failed, that's when you're on a teeter-totter. Before the backup things have failed, there's no teeter-totter. And I say that because I've taught doctors about the teeter-totter. I probably coined that analogy, and I regret it now because it's only true at the ultimate extremes.
Okay. So then, based off of the levels I've given you, would you say
you got too much?
I've got way too much? Because then the the TSH should be increasing or lowering based off of NP thyroid?
Well, so lowering a dose would raise your TSH, but your TSH is suppressed right now. And that can make you not feel well and give you a big, long list of health risks.
Okay. But then my free T3, does that look good? Being at 4.5?
That's reasonable. So one big misunderstanding is that also because people assume this teeter-totter thing holds scales all the way around, they think if healthy people have a low normal TSH, they assume healthy people should have a high normal T3 and T4. It's just not true. Healthy people don't. Healthy people tend to have a big range of T3 levels. Those that always have high T3 levels, they're not healthy people. They have more complications, more issues that show up.
Okay. So you'd say the best course of action would be to lower my thyroid dose.
You need less.
Okay. By how much less are you saying?
The thing is, your body will answer that. In terms of typical size and requirements, I could have told you that was probably too much. The smartest thing is to go down by the smallest increments and then watch frequently and then just let things level out where they do. If you are on the thyroid reset diet, you may not need any over the course of some time, and you'll likely need less.
Okay. Well, yeah, that was my next question. So thank you. I'll look into those resources.
You're sure welcome. Have a good rest of your workout. You too. Bye-bye. Okay, let me grab a couple more. That was a good question. A lot of illustrative things came up. I'm going to get a few more. Paul, you're up, Paul. Let's hear what you've got for us this evening. And this might be Paul or Paul's account. It's all good either way. But let's hear what we have here.
It's Carolyn Blunt. Hi, thank you, Dr. C. I appreciate your time. And good, thank you. I do have your book, and I am doing your supplements, and I've been doing your protein shake. And but here's my situation. I've been tested lately. Actually, it was October, and the TSH is 0.084, which concerns me. Sure. It didn't used to be. It used to be high. My T4 is 1.22. My T3 is 2.5. Now I get this feeling and concern that I have hyperthyroid instead of hypothyroid, but I have the symptoms of hypo.
Sure.
Yeah, some of them, not all of them, but some of them. I'm also taking NP, 75 mgs is what she has me on. And we can't seem to get the Nature Throid, the WP West Throid. And I've read that it's 10 times more absorbent, but the manufacturers don't seem to have it. You're absorbing plenty fine because you're getting too much. So there's not a problem with you not absorbing it. Okay. So, but we can't get the more natural. This one's got the corn because it's a generic for Armor. Should I just let that go? The fact you could do it or Armor, or you could do a pure compounded through a particular pharmacy. But really, right now, you're just getting too much. And this is the problem with the thyroid reset diet. It helps your thyroid work better, and you need less. So it's really only a problem in the short term. But yeah, we're hearing this over and over and over again that your thyroid makes more. The medicine that used to be right is now too much. So it's a problem, but it's a good problem. It's a good problem. Oh, a good problem because your thyroid's getting stronger. Oh, good. Well, can I suggest that to my practitioner that she back off the medicine and would try it and then test again? How soon out after that should we test it? Well, not more than a month. This is a bit of a nuanced answer, but a month from now, I actually like TISH. I haven't heard that before, but it's kind of a nice little way. It sounds like it's a nicer way of saying it. It's smoother and not as stressful. Just a TISH, And I might have to steal that from you. I got it from somebody. But no, so a month out, it should, if it's not budging, that means you've got quite a ways further to go. But on the other hand, it won't be all the way at a steady state. So a month, it takes 3 months to totally level out. But the drawback about waiting 3 months means that it takes a long time to do a couple of tests. So I like to test sooner and then just bear in mind, okay, it should have moved, but it may move further. So let's say we wanted to see you come up to like 1.5. If a month out, you were at 0.5, I'd just then watch it and say, okay, maybe you'll drift up further.
But if a month out you didn't budge, say, oh, we've got to go more than that. That wasn't enough. So that's the thought process about testing early.
So maybe go down from 75 down to 60?
Yeah, between you and your doctor, small steps are always best. That would be the smallest step available. Yeah.
Okay. And then I don't know if this affects it, but I'm taking bioidentical compound, a hormone cream, estrogen, progesterone, testosterone, DHEA. Does that affects my thyroid?
It affects it if and when you change that. So if you weren't on that, that dose would be even higher than it is, because that slightly blocks the thyroid. As long as it's staying the same, that effect will remain as it is. But if she
did change it recently.
So the estrogen part matters, the biased part matters. If that goes up, you may need more thyroid. If that goes down, you may need less. Right now, you clearly need less. But when your thyroid stabilizes, if and when your doctor changes your hormones, you should expect there to be a change in your thyroid needed as well.
Okay. And the iodine, I don't know how to measure that.
You don't have to measure it.
My NP, I don't?
Nope. There's no useful way to measure it, and there's no benefit to measuring it.
Okay, because I'm trying really hard to do everything you're saying about not taking it. I'm doing the gray salt, the Celtic salt, and I'm just trying, but I am eating healthy crackers with sea salt on them. But then I'm thinking maybe I shouldn't do that. I'm 100 pounds, 105 pounds at 5'4", so I can't afford to lose any more weight.
Your thyroid's getting stronger and you need less, so it's good thing.
Oh, that's encouraging, because I was trying not to get worried. From your book about hypothyroidism, when you talked about the things that can come from, the racing heart, the trembling hands, insomnia. I don't have any of that, but it demands urgent treatment. So I thought I got to talk to him if I've got it. So thank you.
Onward and upward.
Thank you so much. God bless you for being so humble and sharing such a health journey mission. Thank you so much.
That's sweet of you. I appreciate that.
Okay. God bless you. Bye.
Let me get a couple more time. I'm going to grab a few names I haven't seen before, but I'll stay pretty close to order here. Monica, let's hear what you have for us this evening. Go ahead, Monica.
Hi, Dr. C.
Oh, Monia. I didn't read that very closely.
Monia.
Am I saying it right?
Yeah,
that's a pretty name. I've not seen that before.
Thank you. I am fairly new as one of your followers, and I'm just sort of investigating a possible thyroid issue.
Okay.
I have many of the symptoms. I have high thyroglobulin antibodies. My TSH is 3.06, T3 is 3.0, and T4 is 1.1. So, and my antibodies are 252. Is that anything to be concerned about?
There was a gal at the very beginning who talked about her odds of this becoming a problem. You're not too different than where she is. You're in a slightly different category. So your 9-year odds of having that convert to overt hypothyroidism, I could be off by between 2 to 3%. So forgive me if I'm a little bit wrong, but you're somewhere at about like 13% 9-year risk of developing overt hypothyroidism. So it's not that your thyroid is destined to hell in a handbasket like tomorrow. It does have more risk because of that. But yeah, it's roughly a 14% risk over a 9-year period.
Okay. And would you recommend me starting any of your programs or supplements?
The thyroid reset diet, the daily reset bundle, the antibody support, and those things, you could probably do fine from that. Your odds of seeing things improve and stabilize are exceedingly high. You're in really, really good shape.
Okay, great. And one last quick question.
Yeah.
Have you ever seen paresthesia as a result of a thyroid condition?
It can be. Paresthesias can come from so many causes. So what happens there, this is the pains, numbness, tingling in the extremities, commonly hands or feet. Is this where something like that you're referring to? Or?
Yeah, I have it in my arms, hands, legs, and in my trunk.
Okay. So the small nerves in those areas are very vulnerable. They're kind of like the canary in the coal mine of the body, and small ways that one's chemistry can be off can affect them before they would affect anything else. Where you are and the scores you told me, I would by no means say, oh, yep, that's your thyroid. your thyroid can do that more commonly when your scores are much more extremely unusual and especially much more hyperthyroid. So if I were guiding your doctor or working with you, I'd really think about other causes of paresthesias before the thyroid. Sleep apnea can be a big one, varying types of anemias, B12 deficiencies, sometimes even acute stress or anxiety can do that, but many other things would be more likely than thyroid given your scores.
Okay, great. Well, thank you. I appreciate the answers.
You're welcome. Good luck with things.
Thank you.
Okay, couple more here. Let's do like two more. Whitney, you are up. Let's hear what you have for us this evening.
Hi there. You can't see me at all. There we go.
Actually, I can.
Okay.
If you meant not to be on camera, please know that you are. You look fine.
I turned it on. I turned it on. So my thing is, I technically don't have any thyroid problems, supposedly. Okay. From all the doctors and tests and things are like, it's not a problem. But I just literally cannot get anything to budge fat-wise. I eat super healthy. I exercise. I do everything. So I'm curious if you feel like the metabolism boost would be actually helpful or what else I can try to make things happen.
Please go deep in the metabolism reset diet if you've not already. Have you looked at that before?
Yeah, I have. And kind of not really anything. And I actually did your adrenal diet reset thing. And I actually gained 10 pounds doing that. And I was like, oh no, what's happening?
The adrenal one is not as targeted for weight loss. There's also a really good support group we've got on Facebook for the metabolism reset. I don't know if you've come across that or.
I haven't yet.
I'll get a link up. If Josh is with us, perhaps he'll find that, but it's just Metabolism Reset Diet on Facebook. Mm-hmm. It's open to public, but we've got tens of thousands of people there. And I have support teams that are there constantly. We literally had tens of thousands of people that have done that. I have yet to see someone to where it didn't work or we couldn't troubleshoot something. Mm-hmm. So there are a lot of folks where it doesn't work, but there's always something we can troubleshoot. I've never had someone to say, nope, it's just not going to work for you. So come on the group, share your experience and, let's start troubleshooting. But, and you're not alone. There are a lot of times to where there can be odd ways in which it doesn't quite connect properly, but let's troubleshoot that. So come on the group and chat there, get active. And I'm holding faith for you.
Thank you. And I've been wondering recently if it's related to liver,
probably, but that's not a barrier because that's what it's really for.
Okay, cool. Awesome. Well, thank you so much. I will look for the link.
You're welcome. Have a good evening.
You too.
Okay, last one for us tonight. Let's take a look. Where are we at on our list? Let's get Heather here. And Heather, you're going to bring it all home for us tonight. What have you got? Heather, going once, going twice. Can you hear me? Can you unmute?
Yeah, sorry about that.
There you go. It's all good.
Wonderful to be here. I know I'm the last question, so I'll try to just give my thing in a quick nutshell. Definitely have big metabolism, weight loss issues. My back history is I had what they call the subacute thyroiditis episode after a stressor in my life when a friend passed away.
Oh, wow.
I thought I was having more like a stress reaction and I was hyperthyroid off the chart. And
so did it take time for that to get diagnosed?
Pardon?
Did it take time for that to get discovered?
No, I was actually playing tennis and I thought I was having a heart attack or something was wrong with me. And they immediately took me in and that was thyroid was one of the things.
I've seen situations like yours where someone has a major stressor, their thyroid starts to go out of control like that. And sometimes it gets thought of oh, you're just anxious, you're just panicky. I'm like, no, this is a medical thing. So I'm really glad that was caught earlier for you.
Yes, it was. Thankfully it was. They did, because I had I think my cortisol levels, things were out of whack after that whole crisis episode. And then I heard, oh, it's just your anxiety. And I'm like, no, this is I'm a pretty chill person to begin with. But anyway, I was hyper and then swung hypo after a certain period of time. And
did they explain that to you? Why it happens or? So subacute disease, your thyroid's inflamed. It's like the thyroid itself almost has an infection, so to speak. And it's not the same way that it happens with autoimmunity in terms of it being broken down. It's more so like it's squeezed. There's so much pressure on it. And the thyroid has a whole lot of little follicles, little clusters of cells that make a space in beside them, the colloid. That's where the hormone is made. I've actually heard of people doing this by doing shoulder stands or aggressive massage. If you can compress a thyroid hard enough, you can make someone hyperthyroid for a little bit. So with subacute, it's so swollen and so compressed, you squeeze out everything you've got. And so, well, that's in circulation, you're hyper. But then it takes a long time for it to make more hormone again. So you get this kind of like you've got like a bank account and you're paying a little bit every week, but you spend it all like in a week. Now you got to wait to get some back again. Now you got the spending spree and then you're broke for a while. So that's right. What subacute thyroiditis is. That's why it's hypo. And when things work well, then back to normal again.
Well, that's my question. I take Tyrosint, and I take Cytomel kind of twice a day, 5 milligrams each time. And my thyroid is just kind of, that was one of my questions to my doctors. Am I ever going to get off of this? If this was a subacute thyroiditis, is it really kind of healthy in there? Will I ever really recover? And my most recent levels were my TSH was 2.28, my free T3 was 2.6, and my free T4 was 0.8. And I've kind of held there for a few months now, or about a year.
The ideal investigation is ultrasound and thyroid antibodies. If your ultrasound shows your thyroid has coexisting Hashimoto's and atrophy, then it's possible the subacute made something come to the surface that was waiting to come to the surface eventually. So that can happen. And in those cases, it might be longer term treatment, not always, but it could be. Let's say though, however, your ultrasound is healthy, you don't have extremely elevated antibodies. In almost all those cases, you would not need ongoing treatment from subacute. And your labs wouldn't really show. If you're getting too much, that'll show up. And if you're getting far too little and you're way underactive, that'll show up. But if you're somewhere in the ballpark, it's more a matter of really the doctor undergoing a process called deprescribing, to where they have a set protocol by which they titrate your dose down and watch your scores. But it's rare to need ongoing treatment from subacute.
If it was truly a subacute.
Correct.
Okay. So, all right. And when they've tested antibodies in the past, I have not had it. Nothing has shown up. So keep my fingers crossed it stays that way.
Most likely.
Yeah. All right. Well, so when I visit Scottsdale, I can come and see you or someone in your practice?
Sure. So our doctors, well, which state do you live in?
I live in Illinois, but we actually have a place in Scottsdale.
Well, we can see Scottsdale residents locally. It's goofy stuff. We can do medical direct care with them. So 2 options you guys have for working with us. Our doctors work with people in Arizona, California, Idaho, Washington, Oregon, and Montana. Yep, I got it right. And in those states, they can work with them via telemedicine. They can prescribe as need be. They can manage all facets of care. Totally fine. Now, me, I don't currently practice. I oversee that and do these other things. But on occasion, I do second opinion consults. And so those I can do with anybody, anywhere. I don't act as a prescriber. It's not medically responsible because I don't do these things consistently. I don't really maintain things. I have those going on right now between March and April. I've got a few of those occurring that I'm doing. And then I'm pausing for the summer and I'll kind of play things by ear afterward. But that's an option where someone can just get my direct input. But as far as management of things, then yes, that is an option with my doctors for people from those areas.
Okay. Not Chicago. Okay. All right. Thank you so much. Again, thank you for your time this evening. It was wonderful.
You're welcome. Okay. So wrap that one up. I'm sorry, there's a couple more questions remaining. If you're one of those people like that, please jump right now into the chat and put your top questions in there. I always do read those chats afterward. And I think about things that, what have I written that I could forward a link, or what should I write about, or what should I talk about in the future? I'll be back next week. We're going to talk about antibodies in more detail next week. And also I'll be on office hours live on Monday. You could jump in on there as well. So my apologies for those I couldn't get to, but yeah, plug that in chat real quick. I will watch that and onward and upward. And yeah, it's really exciting to hear about people seeing their function improve. I know we can see a lot more of this. This stuff can get better. There's strong evidence that this disease can be reversed, that the symptoms can heal. And I think that we need to let people know that this is not the exception. This is the norm. This is entirely possible. And I'm so excited to have more ways to make this available for people. So yeah, good to connect with you all, and have a nice rest of your evening, and we'll see you sometime soon. Bye-bye.